Okay, I'd like to start by having each of our panelists introduce themselves, beginning with Christina.
Hey everyone. Yes, I'm Christina Campbell, science writer, and I have been writing about the microbiome for about 10 years now. I do a lot of writing in sort of medical education for healthcare practitioners, but I also like to write for the general public. And I guess I'm really passionate about kind of trying to ninja some science in where there would normally be no science. So one example is I have a cookbook that I wrote that has 2 chapters of introductory science followed by a lot of high fiber recipes. So just really trying to help people think for themselves and find out what science is out there. Um, I also want to say I had my own gut health issues in the past, and Saffron, I actually gasped in that opening scene when you were in the car because it's so relatable. And I never ended up having a diagnosis myself, but I think it was, probably like IBS, irritable bowel syndrome that was never diagnosed. But yeah, just so many scenes where like I'm in the car, I'm super uncomfortable and I have to pull over, I'm in such pain. So that was what really started my journey as a science writer in this field. And yeah, and I think I'm really happy to have this conversation today. And I think it's the exact right conversation we need to have.
Okay, thank you. Embriette, would you like to introduce yourself?
Yeah, my name is Embriette Hyde, and I got my PhD in human microbiome research from Baylor College of Medicine in Houston, Texas, back in 2014. Um, and my thesis was kind of all over the place because back then the human microbiome research was so young and everything could be discovered and explored. So, in a way, I kind of felt like I had it easy because um, my thesis, it wasn't hard to build up the chapters and to publish studies. But I was involved in some very interesting research on the impact of our oral microbiome on our cardiovascular health, which was a really interesting group of studies. And I also looked at different microbiomes associated with different diseases. And I actually had a really cool collaboration with some researchers in Huntsville, Texas, on human decomposition and how the microbiome contributes to that, and how we could use the microbiome to maybe improve our estimates of time since death in cases where doing so with insects isn't possible or just not very accurate. Once I got my PhD, I actually moved to the laboratory of Dr. Rob Knight, who was in Boulder, Colorado at the time, but then he moved to UC San Diego, and I made the move with him. And Rob collaborates with pretty much everybody on the planet who's doing microbiome research. But one of his collaborations was actually with um, Jack Gilbert of the Earth Microbiome Project and Jeff Leach. And they worked together to create this initiative called the American Gut Project. And this was a way to kind of help the general public get involved in human microbiome research. The Human Microbiome Project, the seminal papers were published in 2012, but it was really limited to Baylor College of Medicine. I was actually a participant in the HMP and a couple of other just very select locations around the US. And it was a very, scientific study, very well controlled. And what Rob and Jeff and Jack wanted to do was kind of open this up to everyone, because the idea was you can't really understand the microbiome if you don't understand the microbiome of everyone, not just this small select population of healthy individuals with certain characteristics. And I actually ended up managing the American Gut Project, which kind of reduced what I was doing in terms of science and analyzing data, but it really opened my mind to how important it is to communicate what you're doing to the general public. And there was a lot of misinformation out there that I didn't even realize. And I would have people asking me questions, and I would wonder, where in the world are you getting this information from? And that really ignited my passion for trying to do a better job of educating the general public, but also helping scientists do a better job of educating the general public. We aren't trained to do that. It's not part of our training. So it's not surprising that we do a really bad job. And so that's why I left academia to start science writing. And I'm available to consult as well if anybody needs help, telling their story in a way that the public can understand and in a way that's responsible.
Okay, great. Thank you. Laura?
Thank you, Brenda, and thank you for hosting this panel today. It's amazing to be on this panel with such distinguished people, and I also share that passion that Ambriette and Christina have talked about of educating the public. So in my role at the Crohn's and Colitis Foundation, I oversee our patient education, our professional education, and all of our support and advocacy services. And part of that work is working with patients and healthcare professionals to educate the community about Crohn's disease and ulcerative colitis and demystify the science that is available and help make that accessible, understandable, and help connect patients who are interested in research to clinical trials and research studies that are available to them. So I'm very excited to be on today's panel to help people navigate this complex world of science and information that comes out so rapidly, and how do you navigate that? So I'm very excited to share and learn.
Great, thank you. And last but not least, of course, Saffron.
Hi, my name is Saffron, and I'm the director of the documentary Designer Shit. In the film, I hear about a treatment called fecal transplant, for which there is some research coming out, but obviously not a ton of research, and I decide to try it. So I guess my role here is on the patient side. How do patients find out about these treatments? And how does it affect them to hear, we want to know about the scientific research, but how does an anecdote of somebody getting better affect a patient? What level of desperation is a patient coming in with that, opens their mind to trying something that maybe is not completely proven? So that's something that I continue to want to talk about. I'm really excited about this panel. It's something I kind of explore in the film. What is my responsibility as a filmmaker and as a patient telling my story and opening people's eyes to the fact that there are these, new treatments out here that some people are interested in trying, and how do we do it responsibly?
Great. Okay, let's dig into some of the questions. So first of all, as a healthcare consumer, we're often warned by researchers and doctors that we need to consider whether a new product or service is well supported by research. So I'd like to begin by asking Ambriette, what does that mean? What does well supported by research even mean?
Yeah, I think you'll probably get slightly different answers depending on if you're asking somebody who's doing the research versus the clinician who's telling you to watch out. But the commonality that they have is what doctors and researchers want to see is that whatever treatment or intervention that you're interested in, there's some research backing it. Now, a clinician probably wants to have seen that go through a clinical trial. And the reason for that, I think we're going to dig into it in a little bit later in the panel when we start talking about concepts like efficacy. But you really don't want to be taking something that hasn't been tested on a kind of diverse population. Most certainly not something that hasn't been tested for the indication that you have. So if you're testing a product on a healthy group of people, but you want to say that it should be used by a group of people with a specific disease and you haven't tested that, that's not well researched, because you have no idea how it's going to impact the individuals for which that product is designed. And there are a lot of resources out there, which we'll get into the panel, to try to figure out if something's been well researched. But just kind of as a general example, if you see something and there's a research study done and they only tested 10 people, and that's the only research study you can find, that's not well researched. Just because it has a study published, you can't really tell anything with that. You can't even get beyond something what would be called statistical noise to find out if any impact is significant for those people. And so when your doctor is telling you it needs to be well studied, that's essentially what they're talking about there.
So when I find out about something, I'm going to Google it right away. And normally what comes up is a huge long list of, ads, articles, Wikipedia, some are research articles. Give us some general guidelines on how to sort through this information. I mean, how do I even know which is research and which is just opinion?
That's such a good question. I'll start, but I would love to hear, from Christina and Laura and some of the others as well. Usually what I tend to do is, especially if I want to put on the hat of, okay, I'm coming at it from somebody who maybe doesn't have a PhD or hasn't been trained in science, because a lot of these research studies that come up, even for somebody who's a scientist, if it's outside of their field, they can be really dense and difficult to understand. The writing is usually an inactive voice, so it's just hard to read in general. And so it's really hard for anyone to really kind of go into those and understand something. There are, of course, very good exceptions to the rule out there, but generally I would look for something like Harvard School of Medicine usually does a really great job of summarizing research studies and the research that's out there and paring it down for people. You've got the Mayo Clinic. They also do that. A lot of different organizations, depending on what disease you're interested in. So I know like the Diabetes Foundation, you've got a lot of different organizations. Laura's, of course, the Crohn's and Colitis Foundation, do a really great job of putting out information. And so my general rule of thumb would be, if it's coming from a reputable organization that doesn't necessarily have skin in the game, in other words, they're not spending billions of dollars to sponsor these studies, it's probably something trustworthy. I wouldn't go to Wikipedia. Just because, I mean, we all know Wikipedia can be curated by anybody, and so anyone with an opinion could put something on there. So I would stick to some of those organizations that are trustworthy. The articles are written by clinicians or PhDs. They know what they're talking about. They know how to do the research and find the studies, and then they can kind of pare it down and make it easier to understand for people.
Okay, so look for associations or articles that really do a review of all the research that's available, as opposed to just reading one research article.
Yeah,
so,
absolutely.
Christina, I have a question for you. But say I decide that I do want to read a research article. And this is something I do on a regular basis. And I'm curious as to what makes a good research article. So, for example, if I can choose between, and normally I'm going to tell you right now, I look for the one that tells me what I want to hear. Oh, that's good news for me. But should I be looking at the date it was published? Should I be looking at sample size? Should I be looking at the journal it was published in? Like, can you give us just some really general kind of tips for, as a layperson, what I would be looking at to indicate that that is in fact a good study that I might want to hang my hat on?
Yeah, for sure. And I mean, yeah, there's definitely no need as a layperson to really read the whole thing. It's likely there's a lot of jargon and you may not understand it anyhow. So, but the abstract is really good to start with. And usually the abstract has the basic information. So definitely look for recent articles. So, if they're more than 10 or 12 years old, chances are things have advanced a little more. And then, so you can look for a more recent one on the same topic. As Embryette said, definitely in humans. I think that's a huge thing in the microbiome field now. And we're at this stage in the field where there are lots of human trials that they may have been informed by some initial mouse study or other, in vitro work, but then brought into humans. So definitely look for that. And I think intervention studies are also pretty powerful. Like if they've taken a population and given them some sort of treatment rather than just observing in a large population. Observational studies are really great too, but I think the evidence from an intervention is actually a lot stronger if they actually do something in the population. And then again, sample size is another one. So the bigger, the better. And some of the intervention studies may not be overwhelming in their numbers, but just if you have 2 studies, the bigger one may be more powerful. So if it has 50 participants as opposed to 10, that's a good sign. But I want to say that I think a shortcut to all this analysis is to look for people's opinion on an expert opinion on the study. So what I sometimes do is take the journal page, the web page that it's on, And then I enter that URL into social media or, just online to see, or the title, Google the title and see if anyone has commented on it. Because
good
sometimes an expert opinion, like a scientific opinion on the study, is way more valuable than anything I could tell by looking at the article myself.
Very good. No, that's great advice. So Laura, I mean, the Crohn's Colitis Foundation is this is what you do. You have a whole advisory team. You look at new treatments and therapies that come out. You sort through. Can you just walk us through how you go about doing that and who your team is, and so that we sort of know the level of work that organizations like you do on behalf of healthcare consumers?
Sure. So first and foremost, we're listening to the patients and trying to understand what they're seeking so that we can then go out and address their needs. So once we do what we call a needs assessment, we then bring together a group of patient advisors, physician advisors. If it's in the microbiome space, we're bringing together experts in the microbiome, or if it's in diet nutrition, we're bringing in experts in diet and nutrition and working with them to sort through the education that's needed there and get the evidence that supports what we're talking about, whether that's the microbiome or diet. And then we develop a content outline. We review that with our patient audience to make sure we're really meeting their needs. And then we begin to develop the materials. And we often take the approach of developing materials that can address different learning styles. So I love the advice of Imbriette and Christina on how to navigate the scientific articles. And for a good portion of the population, being able to navigate and read those articles and abstracts is great. But there are other people that might need the information in a different way and a different accessible. Some people may need a visual understanding of what the microbiome is and education at a level that's very accessible to the general public, at an 8th or 5th grade level, depending. And then we try to then get that information out in social media and small bite-sized blurbs. For a research article, we made work with our physicians, the researchers and patients to translate that into a lay summary so that the most recent evidence on fecal microbiota transplants or other articles are there in a lay summary that's easily accessible to someone at maybe a 5th grade reading level. And finally, we may put out a position statement on a topic that's really important to help people navigate both the physician community that may not be as familiar with this research and the patient community, letting them know, here's the research that's gone on about FMT. Here's the evidence that exists right now. Here's where you can find additional studies and, more research is needed so that people know where the foundation stands on a particular topic and where they can go get more information, clinical trials or other research studies. So that's, a lot of information, but there's multiple steps in ensuring that the patient community, the caregiver community, and the general public are able to access information in a way that is meaningful to them and at their educational level and in a voice that they can understand.
Okay, that's great. And I'm sure that other associations that represent other types of illnesses have the same process. So again, like to everybody's point, those associations, patient advocacy associations are a good source.
And look
so
for
Saffron,
reference
as a
material from the I was just going to add, and look for reference materials on those associations' website. If they're using that methodology, they're going to have references at the end of their websites or pages for people to go and link to additional information.
Okay, great. Okay, so Saffron, as a layperson, before you started researching and interviewing experts for the film, I'm sure you, like most other people, were constantly consulting with Dr. Google. You had the opportunity when you were filming, obviously, to have all these amazing experts at your disposal to interview. And I'm sure that you learned a lot about the process of researching the efficacy and risk of FMT and various other therapies. So knowing what you know now, how would you advise a friend who was doing research? And I'm sure that you have a lot of friends that say, oh, I just looked at this and this looks really, really interesting. And I'm sure now you're coming from it from a different point of view, whereas before you might have said, oh yeah, that sounds good, and bought into it. Now you're kind of coming from the other side. So what advice would you give to lay people that are just doing casual searches on the internet?
Well, to start with, I just want to say that, the way I found out about fecal transplant was an article in the newspaper. This was like 10, 15 years ago. Today, my Instagram and my TikTok knows that I have colitis. It knows that I have a newborn baby. It's constantly feeding me videos and information about, like, is your baby gassy? Try this diet. Like, it's constantly telling me medical advice. And I tend to be skeptical. I tend to, whatever I see on the internet, think, let me double check that. Let me see if there's a clinical trial. I, to the best of my ability, try to decipher the information that I'm reading in these clinical trials, which is it a human trial? Is there a risk? If there was a human trial that showed some significance and no risk, like a supplement, if I know that it's risk-free, I would be more likely to spend the money and try it. If there's a risk, it's something that I have to think more about. And like you said, I was lucky for this film to interview a lot of researchers. But also, like you said, Brenda, I was kind of looking for the answer that I wanted, because of the researchers that I spoke to, a lot of them had experience with fecal transplant, either in clinical trials or doing it for C. diff patients. And it was about half and half of people who were like, I would never try this. I would never advise my clients to try it. But there were a couple who would say, you know what, I would try it. Barodi was one of them. He was very kind of open about the fact that he would allow a patient to try it on their own. And that was what I was looking for, to be honest. So what advice would I give to a patient? I think that panels like this are really important. I'm still learning. I'm learning on this panel right now how to properly decipher information. It's still a learning process for me. And just understanding that these things that are being fed to you on the internet, it's getting worse and worse every day. So you really have to put on your critical thinking cap.
Right. So let me ask about the point that you've just brought up, and that is risk versus efficacy. Britt, can you maybe, again, walk us through just generally, like when we look at research, we're looking at risk and efficacy, and what are those two terms? What do they mean?
Yeah, these are two really important terms to understand, because when you think about whether it's a supplement or a drug or any type of intervention that goes through clinical trials and ultimately gets approval, those are two very important factors that go into that. Efficacy obviously is critical, because that is the ability of the intervention to have the desired effect. So if you're designing something that's going to treat C. diff, does it actually reduce, symptoms? Does it reduce the severity? Whatever it is that your endpoint outcome is that you're looking for, does it effectively do that for a majority of the population? That's the other important part of this, is what percentage of people does it work for? Because it could be efficacious for a very small proportion of the population, but maybe not the majority. And that doesn't necessarily mean it's bad. It just means that it could be an intervention that is needs to be marketed and targeted for that very specific group of people, and that's okay. Risk, on the other hand, is, what is the potential for harm? And so we've all seen the commercials on TV where they kind of like go through really quickly the side effects. It scrolls by in small words, and you're thinking, why in the world would I even take this drug if it could do this or this or this? And so I think that's like the best example that I could give that people on the panel are probably familiar with. And most of the time you're going to have some type of risk. It could be very, very small. The side effects could be really mild. Maybe you just get a little dizzy. But if you're, suffering from a recurrent C. diff infection where you have to run to the bathroom every 10 minutes, that other side effect might be, yes, please give me that, because I would so much rather deal with that than what I'm dealing with on a day-to-day basis, because I literally can't function. I can't do my job. I can't do my hobbies because I'm, tied to the bathroom. So those are the types of things that people will need to consider, and that Saffron considered. And I think she did a really great job in the film as well of explaining, her thought process and some of these things that she was grappling with and struggling with when she had to make her decision.
So, and I'm going to come back to you in a second, Christine, because I have a question for you, but I want to stick on this topic for a second. Laura, does Crohn's and Colitis Foundation specify this enough in your education? So, as an example, I, as a consumer, need to obviously know what the risk is of taking something. And I also need to know how effective it is, or what the percentage, or what the chances are that it's going to be effective. However, is that not my call if it's safe? Like, why would any organization care if I spent, $100 a month on a treatment that was safe? So I knew it was safe, and I'm risking spending $100 a month and it's not doing anything. So is that something that the association, I guess, clarifies in patient education material?
Yeah, so any organization should be educating the patient and their caregiver about the risks versus the benefit of any therapy, any treatment, any clinical trial. And then we really encourage patients and their caregivers to talk to their healthcare team. And a good healthcare team is going to listen, want to engage with you, and understand all the treatments that you're using, whether they're FDA approved or not, and talk to you about the risk versus benefit, and whether or not, given the cost, because cost does play into these decisions, is it really helping you? And I really encourage patients, if they can't have that conversation with their MD, their medical practitioner, talk to the nurse, talk to the PA, really make sure that you're sharing everything you're taking, because there could be unknown side effects of different combinations of complementary or alternative therapies that someone might be engaging with. And the only way that's going to get discovered is by having that candid conversation. And also reach out to, we host an IBD help center where we have masters in social works that can have these risk versus benefit conversations and get a patient a second opinion if they need one, if they're not being heard by their healthcare team. But it's really, to get to your question, patients should look for organizations that are not just telling the good side of the treatments, but they're also talking about the risk. And they're helping patients understand the numeracy, the percentages, there's a whole language of medicine that is hard for patients to understand in terms of sample size and percentage efficacy. And that's part of the education as well, is helping patient understand actual risk and using those great graphics that show, 1 in 1,000 patients have this risk. So, I think any good organization is doing that type of candid risk benefit. These are the facts. These are what you need to look for in terms of side effects.
So that was the question that I was going to ask Christine, is that when we see these ads on TV and we see them listing, multiple risk factors, again, as a consumer, like, first of all, it sort of scares you because you think, oh my God, like, who would ever take that, right? So as a consumer, how can I go back and put some percentages around that? Is that information available? Because they list all of these side effects, yet the actual risk of each of the side effects could be 0.01. So is there a way in which you can quantify that?
Yeah, I mean, well, I guess I just want to make a larger point about food and dietary supplements versus drugs in the first place, and that we have, our regulatory structures as a society are set up so that with foods and dietary supplements, we accept almost no risk. Because there are lots of different things to eat. So if something's risky, you want to eat something else, and that's why you see recalls. Recently in my area, there was a recall on cantaloupe. So if you have this cantaloupe, just take it back to the store, throw it away. Just do not eat it, because we've decided risk is not acceptable for food. However, for drugs, risk is acceptable, and like Embriette was saying, if you're close to death or if you're suffering a lot from a condition, and the drug can help you get better, then yeah, you're going to put up with some risk to get that great, amazing benefit. And so as far as quantifying, I think, it is very hard for the average person to quantify what, first of all, understand what the data says in terms of risk, but then I think it is a very personal decision as to what you're willing to tolerate as far as side effects. So, if you read through the list of side effects, and ideally you're with somebody like a healthcare practitioner who can tell you, okay, these are the top 3 that they've observed. Then it's very personal. Like if, depending on your lifestyle, if if your job is in like TV and there's a risk of a lot of skin conditions that would make you not able to do your job and even be on TV, right? That's not going to be an acceptable risk for you, but some, going to the toilet more often may be okay for you. So yeah, it really depends on lifestyle.
Yeah, that's a great point, actually, is that the risk may affect people differently depending on whether they work from home or whether they're out in the office, whether they're on camera. Yeah, great. You can't risk having a face rash if you are a broadcast TV personality, right? So, Saffron, did you consider those 2 as separate entities when you considered and made your decision to do FMT on your own?
Yes, of course. Like I said, I mean, I was first introduced via anecdote. It was a story in the paper, and then I met the actual person, Charlie. And I have to admit that I was influenced by an anecdote. I was somebody who was just feeling really desperate and looking for hope, and this story gave me hope. So that was my way in. And I really wanted to believe that it would work. So in terms of efficacy, I was seeing that the clinical trials based on my condition, human trials, fecal transplant for ulcerative colitis, were showing about 25 to 30% efficacy. To me, the level of desperation I was feeling, that was enough. I will try it. I will go through all the effort to try it if there's a 25% chance that this will work for me. In terms of risk, that was something I had to consider. The trials that I saw didn't have a huge degree of risk. And I was thinking about the fact that there were a lot of trials on C. diff that showed a very small degree of risk. In fact, at that point, it was FDA approved for C. diff because it was considered safe. So I brought that into my equation as well. I think I had made up my mind that I really wanted to try this because I was so desperate and I needed to try something new. So the fact that my donor was my partner, I knew that brought down my risk a little bit. These are all the things that I thought about in my risk versus benefit ratio that made me decide to do it. For somebody else, that ratio might be different.
So I have a question, and it's with my very simplistic mind. So it's a question for Embriette and Christina. So FMT has been proven safe enough to treat C. difficile. So the fact that it's safe to treat one condition, shouldn't that make it relatively safe to treat any condition? And if not, why not? Like, how can it be safe for one condition and not for another condition?
That's a great question. Do you want to go first, Christina?
Yeah, sure. I mean, I think it does mean there's a basic level of acceptable safety, but it definitely does depend on the condition that it's treating, because like people with recurrent C. diff, their lifestyle is completely disrupted and they may be close to death, right? So it's a very extreme condition. But yeah, like again, going back to skin, like if it's eczema, it's uncomfortable and not great, but you wouldn't want to be doing a very risky treatment for that to get rid of a skin condition. So I think it really does depend on the condition. And again, goes back to that benefit risk ratio, and that's why it needs to be tested. And plus, the physiology may be different between various conditions, and it just may not work as well. So then you're having risk without benefit.
Yeah, that's
Anything
a
to
great
add?
answer. One of the things that I was going to bring up too is it's really important to know, like, when these research studies are being done or the clinical trials are being done, who are the donors and how are they screening them? Because safety is inherently written into the protocol. So the protocol is written such that, of course, you want to maximize the safety. And one thing that I was seeing, not a lot, but every once in a while, is that people would just, not do as Saffron did. She knew her partner, she knew the lifestyle, she knew the history, but they would just try to get a fecal transplant from anyone who wanted to provide one and do that. And that is very risky because that person hasn't been, did you test them for STDs? Did you test them for other illnesses that could be transferred through the fecal transplant? That is all done in research studies and in clinical trials. And so that is a very important thing to keep in mind when you're considering safety is, okay, it was shown safe in these trials, but I should probably follow the same, safety precautions that they used if I'm going to do this on my own. And so that is just one point I wanted to bring out because that's something that a lot of people don't think about. And I think it's because we don't mention it enough. Like we really need to talk about that. I had a very, I was like this moment of, see, I told you, when I was still in the lab, is somebody had posted on Reddit that they did a self-fecal transplant for something. I don't remember what it was that they were trying to resolve, but they actually gave themselves C. diff. Because the person they got their sample from had that in their gut microbiome. So they kind of just made the problem worse. And that really highlighted the importance of, you have to screen whoever it is, even if you're doing this on your own, to really know that that person is not going to transfer something to you.
Yeah. So in other words, the method of delivery also makes a difference. And so something can be delivered safe with a particular type of process method of delivery, but that doesn't mean that anybody can do it because it's not following the process, right?
Right.
Laura,
and the other thing,
sorry, go ahead.
Sorry. I'm going to say too, the other thing also with the case of C. diff, because there have been so many studies done on it now, and as we mentioned, it's FDA approved, we're beginning to understand why it's working in that case. So we have a pretty good idea of the mechanism of action behind what's happening when you replace the community and why it's so effective against C. diff. That's not the case for a lot of other diseases. We're still in that process. And so there's a little bit of an unknown there. And certainly I would be really shocked if the mechanism of action was the same for every condition. And so that's another reason why the trials are important, and another reason why it could just not work in your case if you're trying it for something else for which we don't understand the science behind it.
Okay, good. So before we move on to some audience questions and some really specific examples, Laura, I want to ask you if there are any advances in artificial intelligence to make it easier for people. And I think maybe I was imagining it, but I thought in a previous conversation you told me that Crohn's and colitis might be working on an app. It may have been a conversation with somebody else, to be honest with you.
Well, I was intrigued by your question, Brenda, because AI is being used in insurance decision making and other things that are actually very harming to the patient community. And so I thought a lot about this question about AI, and I think just like we've been talking about, there are risks and benefits that will come with AI. AI may help people navigate and get information easier in concise ways, easily understood, but it will depend on who's feeding the artificial intelligence the information. So, in a dystopian, Orwellian world, you can imagine a evil corporation feeding the AI system information, and that is what will be fed up to the patient community. And, you know, the utopian world, the evidence is being fed up, it's being then translated into easy to understand information, and the risk and the benefits are being provided. And then in my ideal utopian world, a list of doctors and clinical trials are easily fed up to the patient to go find the appropriate trial. So I do think AI has potential. I just think, like most things we've been talking about today, you have to know your source of where the AI is getting their information.
Right. Okay. Yeah. Yeah, I guess it wasn't you. Somebody told me that somebody was working on an app to help consumers kind of just sort through good studies versus bad studies. But you made some really, really good points there. And some things just can't be replaced by basic human intervention, right? So the comedian David Spade has a new show out. I'm sure all of you have heard it. It's been advertised a lot. It's called Snake Oil. And the basic premise of the show is to tell contestants about some type of treatment or product, and they have to guess whether it's legit or if it's snake oil. So I will be shocked if fecal transplants don't make it onto that show. And my question for everyone, and we'll just have to wait to see who the winner is in this, is that what do you think if FMT was presented on David Spade's show? How would people guess? Would they guess that it's snake oil, or would they guess that it's legit? And do you think the reason for that is because they're hearing about it, or because it sounds legit? Saffron, what do you think?
I mean, I talk to people about fecal transplant all the time these days. It's so normal to me that it's shocking when somebody hasn't heard about it. I think for the most part, people think it's made up. People think it's like really weird, and like that's clearly not a thing, and only a total weirdo would want to do that. And then when we tell people that it's actually used for C. diff and it's very effective, they are blown away.
What is everybody else's guess? Will people think that it's legit? Like, just based on, like, if you didn't know anything about fecal transplants and somebody said to you, oh, this is what you do. You take somebody's poo, you put it in a blender, and you put it up your bum. What would you guess?
Yeah, no, it sounds pretty preposterous, honestly. It sounds like a kind of like a teenager's like horror treatment or something. Like
Yeah.
But yeah, no, I think because gut health information is ubiquitous now, like a lot of people have heard of it. But yeah, definitely, you know, thinking back to the first time any of us heard about it, yeah, I think that might have been the reaction. Like, wow, really?
Laura and Embria, what's your guess?
It depends. Oh,
Go ahead.
it depends on who he gets on the show. Like, it could be hit or miss, right? It could. And I like to use athletes as a great example, because especially professional athletes, they've been known to try some really off the wall things to try to improve their athletic performance. And so if he just happens to have one of those people, they might say, yeah, it sounds crazy, but I would, I would do it if you're telling me that it could have this impact. So it kind of just depends, I think. But yeah, I echo what Saffron has said and what Christina said. It's just at face value, if you didn't hear about it before, if you hadn't been doing the research, or you didn't know somebody who did it, you'd probably say no way.
Yeah. Laura?
I agree. I think the IBD community, the gut health community, if they're on the show, they're going to know about it. But the general public that might not be as familiar with gut health and digestive diseases, they're going to think it's snake oil.
Yeah, and I bring it up, and we'll take a few more examples after, but I bring it up because I think, again, it's really important for people to understand that even when something sounds perfectly legit, it makes total sense, it doesn't necessarily mean that it is legit, and vice versa. So let's just go through a few other examples, and then that we wanted to bring up. And then I have some questions that have come in from the audience. So we'll just go through these quickly because we have just 10 minutes left. But there's one type of therapy that came up actually while we were filming Designership by one of the people that we interviewed, and that was helminthic, I don't know if I'm pronouncing that correctly, therapy, which is essentially worm therapy. So Laura, you had said that you would speak to this and provide people with information. Is it legit or is it snake oil?
Well, it's real. And there was a number of studies done as starting back really in 2008 and forward that were addressing the hygiene theory and inflammatory bowel disease. There's one theory that as society has gotten cleaner, we get less exposure to worms and other things, and that might be one of the reasons we see an increase in inflammatory bowel disease. So there was research done. There's been at least 9 studies done using helminths, which are whipworms that are ingested and they go into the gut. And unfortunately, the safety on whipworms is good. The safety's there. But the efficacy, the effectiveness of the treatment has not been proven yet. So the jury is still out. Additional clinical trials or research could be done here because it's safe. But whether it's effective in treating inflammatory bowel disease or other conditions is yet to be seen.
Okay. So again, great example of something that when Saffron and I first heard of it, we went like, that can't be real. It just cannot be a legitimate treatment, yet there is some research on it. And Laura, sticking with you, the other thing that we have been told, and Saffron and I argued about this for quite some time, is that smoking cigarettes is good for Crohn's colitis. True or false?
It's nuanced. It's so smoking has been found to be protective for ulcerative colitis patients, and it has been shown to be damaging for Crohn's disease. But here's there have been clinical trials using different formulations of nicotine and tobacco tar, trying to understand, again, the effectiveness of this therapy. And the evidence right now is that we don't understand the mechanism that is making smoking protective in ulcerative colitis. So right now, the physicians I've spoken to, what we say at the Crohn's and Colitis Foundation is we would never want to put a patient at risk of developing other potentially devastating diseases like lung cancer by encouraging smoking. And there are other effective therapies for managing ulcerative colitis. So until we understand what's happening with nicotine or in cigarettes, don't use smoking as a therapy for ulcerative colitis.
Yeah, and that one was just shocking to me because I thought that can't be true. But then again, okay, so this is a question that Embryet has agreed to sort out for me, because I am of the age now where friends of mine are saying, oh, have you tried this for improving your memory? And one of them that's recently been suggested to me is a supplement called Prevagen. And it's really expensive. It's about $70 a month. And it's, it says on the bottle that it's based on a clinical study of subgroups of individuals who are cognitively normal or mildly impaired. So as a consumer, I'm looking at this and thinking, if there's even a chance that it helps my memory, not that my memory's that bad, but got to stay on top of these things. But it's expensive. So Embryet, walk me through how I would figure out whether this is something that is worth me investing in.
Yeah, this was a great example because I just went through the process that I kind of alluded to at the beginning, one of the first questions you asked, and some really great stuff came up. So just to kind of walk you through what I did is I actually hadn't heard of this before. So maybe I'm just living under a rock, but I looked it up really quick and I found that the main ingredient in this supplement it's something called, I don't know if I'm going to pronounce it correctly, but it's a protein that comes from jellyfish, I believe, and it's called, I'm going to sound so dumb when I pronounce this, but it's apoacorin. And what I found from putting something into clinicaltrials.gov, this is a resource that we haven't actually mentioned yet on the panel, but one thing that anybody can access, it's a website called clinicaltrials.gov. All the clinical trials that are being performed in the United States are registered on this website. And that would be any active trials as well as past trials, and people can search for them. They can find a list. They can see how many trials are being done on either by intervention, whether it's a drug, or by disease state. There's a lot of different ways that you can stratify this. So I just put the name of that protein in there, apoacorin, and I came up with 0 hits. And that was initially like the first thing that kind of clued me in that something was a little off, especially because on the website, it's being advertised as a clinically proven thing. So that was like the first red flag, ding, ding, ding. Like they're marketing it as clinically proven, but it's not. So what exactly is going on? So I decided to try to find the actual study that was done that is behind these claims. And I did find it. And it's really interesting because if you actually read through the conclusions, the researchers even say that there were no statistically significant differences in most cases, but there was a significant effect if you just looked at a certain subpopulation. And they kind of wrote that off as saying, well, it's the people who have mild or 0 cognitive decline already, it's improving their cognitive performance. And that's exactly who we're trying to market this for. So that's great. But if you dig a little deeper, what you find is that really important when they looked at, essentially what they're doing is they're looking at people's performance on different tests that are supposed to determine like how well their recall is, what is memory, what's their cognitive performance. So these are, a general battery of tests that are used. And what they failed to do was retest the control group. So they saw this significant improvement in tests on the people who were taking the supplement, but they didn't do the same with the control group. So it's really impossible to tell whether the improvement was a placebo effect or not. And the other very important thing is a lot of times these tests, people just kind of learn how to do better with them. So it could just be because they learned, they'd already taken the test before, they learned and they were able to do better. But it's impossible to know because we didn't test that control group. So that would have been enough for me to be a little skeptical. The safety on it seems to be okay. And so I could say, well, I might risk it, I guess, but given what I'm seeing, I don't know if it's worth $70 a bottle to do it. But then what really kind of halted me was I found, and it wasn't very hard to find this at all, I found some issues with the FDA, with the company who's making this supplement, particularly with the claims that they're making, how they haven't, do justice to the science behind it. There's actually a letter from the FDA to the company that's outlining everything that they've done wrong, outlining the fact that they met in person with individuals at the company and were assured that these issues would be addressed, and they weren't. And so that was like, okay, no, I'm not gonna I would not give my money to a company that clearly doesn't care, because it just seems like a marketing thing and a way to make money. And it seems to be working because pharmacists is still, it's being recommended by pharmacists. I found a very interesting paper on PubMed, which is another resource that anybody can access. It's the repository for research studies, and you can search, any term you want to in there and find studies, some of which you won't understand when you try to read them. Like that even happens to me, but sometimes you'll find really good ones. And I did, in this case, found a really good one that kind of explains some of these pitfalls. And I also found a really great publication from the Alzheimer's Drug Discovery Foundation. So going back to what I was saying before, sometimes what you really want to find when you're doing your research is something that comes from a foundation or an organization or a hospital that really kind of breaks it down for you. And they have a 6-page PDF where they go through everything about this, I guess, supplement is what you could call it, and kind of why it's not really proven to be efficacious. And they go through step by step. The language is really, really nice. It's kind of, I think we were talking before, we were saying like 5th grade, 8th grade level is really clear and easy to understand. And so if you want it, Brenda, I'm happy to send it to you afterwards so we can look through
So
it.
I have a quick question for you, and then I want to ask Christina something, and then we want to get to, there's a question in the chat. How many hours did that take you?
Oh, it took me about 30 minutes. Yeah,
Okay.
it wasn't long.
Okay.
Mhm.
Because that's important too. I mean, people kind of go, oh my God, like where would I begin? So
Yeah.
Christina, I want you to make a statement on why is it that as we're awaiting regulatory approval for things like FMT for Crohn's and colitis, there's a multi-billion-dollar business being created around gut health, and supplements don't seem to have to go through the same rigorous testing in order to be sold in our local pharmacies. How do we justify that?
Yeah, and I mean it's to do with the regulatory system in that like in the US and many other countries, dietary supplements fall under more the food category than the drug category. And so they're not allowed to say that they treat or mitigate or cure any specific condition. So they have to keep their language general. And that's why you see on supplements like, helps healthy digestion rather than like cures ulcerative colitis, because they just literally can't say that. But it's also the case that in the US, people can put products on the market, and then the FDA does like post-market surveillance, which means then the FDA responds to complaints or sees what they say about it. So there's less pre-approval, and then it's more about like looking at what they do once they're on the market. So I think if a company's been around a long time and they have a good relationship with the FDA, that's a really good sign. If they're new, and as Ambriette says, if a Google search reveals they have problems and letters issued from the FDA, not a great sign. So I think that's one metric to use.
Laura, very quickly, can you see the question from Laura in the chat? She's and maybe this is something that we'd have to get back to her on, but she's asking about a company called Eventure and their Cure QD nutraceutical 6-week protocol specifically for IBD sufferers. Is this something that your organization has looked at, or is this potentially something that she could submit to your organization?
Absolutely. And we could do some of the research for her, get her any relevant studies that may exist, for her to then talk to her healthcare team about whether or not this would be a nutraceutical to consider.
Okay, that's great.
And I'll put in the chat the IBD Help Center where.
Okay, that's perfect. If we can spend just another 3 minutes, if everybody's okay with that. Because there was some questions that came in, really specific questions. And again, if we don't know the answers to them, we can just maybe provide some guidance as to how to look into it. Is juicing legit? We're playing our game again.
Well, I guess I'd say
snake oil.
As far as the microbiome, I don't think your microbiome likes juice as much as it likes the whole fruits and vegetables. Maybe Ambriette, you can speak to this, having worked with the American Gut Project.
Yeah, exactly. The problem with juicing is that you get rid of the skins of whatever it is that you're juicing, and that's where the most fiber is. And microbes love fiber. So
is a cap full of apple cider vinegar good for you each day? Has anybody done any research into that? No? Okay. Are these new probiotic sodas a good idea? So I guess there's probiotic sodas out there now. Does anybody know anything about them?
I don't know anything about them, but probiotics should be something a patient talks to their physician about and weighs the risk and benefits, because not all bacteria going into your system is going to play well with your intestinal microbiota.
Okay. fermented foods, are they a good idea? Somebody says they help her a lot, but she's wondering whether it's all in her head, the placebo, or is there proof that fermented foods are good for your gut?
Talk to a
Studies
dietitian.
are yeah, the studies are limited and they conflict, and it can depend sometimes too on whether or not you have a pre-existing condition. For example, people with small intestinal bacterial overgrowth, notoriously they struggle with fermented foods. It's not good for them. So just depends.
One last question. Can you talk about bone broth? Does veggie broth yield the same results? I don't know what bone broth yields, but does anybody
I would
know
just
anything
say
about it?
to your microbiome, it's definitely different. Animal foods versus plant foods. So
Mhm.
yeah.
Okay.
Yeah.
Well, this has been a great panel discussion. Thank you all so much. It's been really, really interesting and helpful to me, and I'm sure for anybody else that's watching it. So appreciate your time and your expertise. Thank you.
Thank you.
Bye, everyone.
Bye. Thank you.
Thanks. Bye-bye.